Let's discuss sickle cell disease or overview of sickle cell disease. Disorder, also known as sickle cell disease, is a group of inherited red blood cell disorder. Sickle cell disorder. Number one, sickle cell anemia, HBSS. That is the most common form of sickle cell disorder, where an individual inherits the abnormal hemoglobin gene from both parents, one from the mother and one from the father. Sickle hemoglobin C disease, HBSC. This is a mild severe of sickle cell disease, where an individual inherits the one hemoglobin S from one parent and inherits one hemoglobin C from the other parent. Sickle beta plus thalassemia. This is where an individual inherits one sickle cell gene and one beta thalassemia gene. These partially reduce the production of hemoglobin. Number 4, sickle beta 0 thalassemia. This is where one inherits the abnormal hemoglobin sickle gene from one parent and the beta thalassemia from other parents. But this one actually reduces the production of hemoglobin like completely. Causes of sickle cell disease. So it is caused by a mutation in the HBB gene. What is just a gene mutation? Okay, so what this actually means is that there's a chromosome that is affected, which is chromosome 11. So the hemoglobin content of the red blood cell has undergone this gene mutation, making the red blood cell to assume a crescent shape or a C shape. Symptoms of sickle cell disease. Number 1, pain crisis. This is like an episode of pain that occurs all over the body due to blocked blood flow in the body. Number 2, anemia, chronic shortage of red blood cell leading to fatigue, malaise, and general body weakness in the body. Number 3, there's going to be swelling, and this swelling can occur from the hand, it can also occur from the feet, and it can be painful sometimes, or mostly painful. 4, frequent infection. So, being an HBSS actually predisposes one to frequent infection. Number 5, delayed growth, like slow growth in children and sometimes delayed puberty. The complications of sickle cell disease. The complications include stroke, organ damage, leg ulcer, pulmonary hypertension, gallstone, and so on. Diagnosis of sickle cell disease. Actually, sickle cell disorder is usually diagnosed from blood tests. That's just the diagnosis. Treatment of sickle cell disease. Number 1, medication. Someone can take pain relievers, hydroxyurea to relieve episode of pain, and to also take some antibiotics to for when there is case of infection. The person can take antibiotics. Number 2, blood transfusion. So blood transfusion is going to manage anemia and it's going to decrease the chance of stroke. Number 3, bone marrow transplant. So this is like the only potential cure, like the only cure for sickle cell disorder, and it is actually used for people below the age of 16, like children. So that's just the known cure for sickle cell disease. Number 4, gene therapy. So this gene therapy is actually aimed to correct the gene mutation, like it is aimed to prevent that gene mutation that is causing sickle cell disease. Management of sickle cell disease. So number 1, healthy lifestyle. Yes, from eating balanced diet, avoiding stress, avoiding high temperature that can actually trigger episode of pain crisis. 2, medical checkups. So I'm also guilty of this. I don't really used to do any medical checkups routinely. So routine medical checkups and vaccination is very, very essential for people who are having sickle cell disease. Number 3, hydration. So being an HBSS, you have to drink a lot, we have to drink a lot of water, just to keep that blood flowing to prevent increased blood viscosity. So hydration is a very, very important aspect when it comes to management of sickle cell disease. Number 4, education and support. So this deals with understanding the condition, recognizing early symptoms of maybe crisis, okay, and connecting with people that you guys are having the same health issue, trying to educate each other, create awareness and stuff like that. Prognosis of sickle cell disease. The life expectancy of individuals living with sickle cell disease has improved significantly with advancements in treatments. However, it varies widely, depending on the severity of the disease. I mean, body physiology is very, very different, so the life expectancy varies a lot, a lot. Talking about the awareness and advocacy. So raising awareness is actually very, very important for people to know more about sickle cell disease, which is what I'm actually doing right now. And advocating for each other is also very, very essential. So to the health workers out there, advocate for your patients, advocate for your loved ones that they are having this blood disorder, and Stay healthy, hydrate yourself, avoid stress, avoid stress. Yes, drink a lot of water, and peace. Yeah, like, share, comment, subscribe, and stuff like that. Bye.